the reason why the free healthcare system doesn't work now, Sierra Leone, is due to corruption.
Hello, good evening, my beautiful people. Good evening. Welcome to the Power Hour. This is a topic that I'm truly passionate about because, we're talking about health, specifically the healthcare system, in Africa, most especially Sierra Leone, because that is where I'm from. I can only talk about what I know. And I know Africa is also very different. When you say Africa, you're talking about the difference between like South Africa and West Africa is like, day and night. So I am very much aware of that. That's why I say most especially Sierra Leone, because that is where I was born. I lived for the first 12 years of my life. So that's where I have experienced healthcare. And this is the statistics. Government health expenditure as percentage central health expenditure. So the percentage of expenditure that goes towards health specifically. And the highest, the country that puts the highest, you can see it here, right? These are all African countries. You can see it here. Right, and then the one that spends the lowest towards health, the one that spends the lowest percentage of the total expenditure for the government towards health. Guess who it is? Sierra Leone. And I'm about to have my guest, but before I bring on my special guest, and who is not just a health medical professional that's worked in Sierra Leone and now also in the UK, who is Mr. Musa Vibbie, who is a medical health professional, as I say, a nurse, and also an activist. And I'm excited to have him. So welcome, Musa, welcome.
Yeah, Mona, good evening. Nice to be on this platform. I've been on the look up to this anyway, to be here.
You're welcome. You're more than welcome. Thank you for day or so, and I know you're a busy man, but you've taken time, out of your precious day to be here, and I really appreciate that. So let's start. Tell us a bit about yourself and your journey thus far, whether it be with, in terms of education and also job and all of that and other extracurricular activities.
Let me just make it short. As soon as I know my name, Musa Vibbie, born in Sierra Leone, attended the ROC school, Daru. And because of the war affected us, I went to UBC school, Mobimo, and I went to St. Teresa primary school, race course, and my secondary school was Christ the King College. And after spending years, I came to St. Edward's, where I sat to my wives, and I went back to Jala University. I was the first batch when they made the former paramedical as a medical school. Graduated as a registered nurse in 2010. And I got my first job with Médecins Sans Frontières, Doctors Without Boundary, and worked there as a nurse for a certain period of time. And after that, I traveled to Asia, where I worked for several years. And I came to the Netherlands, where I previously left for the UK, to work and pursue my career, because I'm also at the verge of trying to finish my law degree. So it's a very simple. I'm a very simple man, life-going man, and I believe in a very good health. And I cherish friends and I cherish people.
So what were your experiences as a healthcare. What are your experiences of the healthcare system in Sierra Leone or Africa, but I know mostly like Sierra Leone? What were your experiences?
Well, I have both positive and negative experience, the bad and the good one. In Sierra Leone, the medical system, it need a lot of improvement. Like the period of time where maybe then as Sierra Leone, where I be the work as a nurse, I be the work both with the MSF and I be the work with government hospital. But let's focus on the government hospital because there lies the general hospital for the people of Sierra Leone. If you look the medical stages them in the Ministry of Health and Sanitation, they get cadres and those cadres from the above the minister himself, he gets a deputy, he gets the center medical team right inside the Ministry of Health and Sanitation, and then they go them put that joined to the district hospitals and district workers to the PHUs, which are the peripheral healthcare units or centers. So let's say if like when they introduced the free healthcare in 2010, and in 2010 when the free healthcare system came, one of the reasons why it doesn't really become successful because it was dishonesty within the ministry and the healthcare system. Let's say the medicines that were coming in, or they normally they send from abroad for help the people then get access to it. Those medicines are not going to the peripheral healthcare units. Then let we say, for example, the district, let's say like one district. Let's take example like Kabbalah district or Kenima district, for example. When the medicine they left, by the time the medicine they left Freetown, now the drugstore, they come, they don't cut most of the medicine they don't thief them. And then medicine, and if you go all around Sierra Leone, you see them at pharmacies, you see them medicine in neighboring countries, and people they go sell the medicine the way it be say NGOs or non-governmental organizations that don't cater for send for the people of Sierra Leone. Then take their medicine and they then sell their medicine and they now pharmacies and all the rest. So you see say in the peripheral health units then within the district level, like all these villages where they deal with more maternal child, the mother and the child, they realize they are deprived of getting their medicine because the reason is this medicine has been sold. So my experience was the reason why the free healthcare system doesn't work now Sierra Leone is due to corruption.
What do you think needs to happen to bring about changes? Whether it doesn't have to be just the government, even the people themselves. What do you think needs to happen?
Really, what needs to happen is, as I said earlier, corruption, is something that has actually, captured the development in Sierra Leone. Corruption, because Sierra Leone we don't have much doctors, and that is one of the issues. Sierra Leone has a population of 7.4 million people. And within those 7.4 million people, 1 million people live in the western area. Where in the western area have the most of the referral hospitals. And at the district level, we have few hospitals. We all know, say, Sierra Leone Bidon really, really dead down as one of the poorest, one of the most corrupt, and all of that. This is not about this. We are discussing about health. We are not discussing about politics. But to be honest enough, That country, now we leaders and they don't destroy the country. And not only we and them will make that country, every individual involved.
What are your 5 top tips or steps to success? With everything you've gone through, what would you, if you're giving somebody advice, what are the 5 top things that you would say, these are the tips, or these are the steps, or these are the things that have helped me?
The first thing I will ever say is hard work, and keep on walking, and never in this life give up. Forget about the criticism of people, because definitely it will come. The hate, the gallop on the way. Sometimes you move on, you try for climb a step, you drop. Don't wake up again, stand up and keep on moving. Because at the end of the day, waiting matter on the journey. Now, whose side you arrive, not to whose side you come out. So that will be my advice to people towards success. Keep on working hard, keep on moving every day. Forget about everything that people will criticize you, people will say things about you, but just keep on walking, just keep on moving. Go get it. Be a go get it individual. Move on. Say, this I need them. These are my goals. I need this. Go there, work hard for it, and try to get it. Because without working hard, definitely you will not achieve anything. That's absolutely, I will tell people that. It's not easy. Life will not be a bed of roses. Life is tough. Life itself is tough. So you have to be patient. Patience is another thing. So if I get to tell the 5 things and to people, that is what I will definitely tell them. Yeah.
Thank you so much. Those are great. I couldn't agree more with you, because people always talk about wanting to do things, but it's one thing to say I want to do something. It is another thing of making sure you keeping going, and you are always going to face challenges. That is life, Have a blessed night. Thank you so much, Musa. Have a blessed night, everybody. And I'm so glad you joined us. Or if you're watching this later, thank you. You can still comment even if you're watching it later on. So bye everyone.